So as I say, I'm from a particular group of general practices in Solihull, and we're doing a number of projects which work with the community, which aren't about health. It's about the impact social factors have on health. So things like cost of living are a major thing for us right now, and that anxiety that Alison talked about, we are seeing that with people coming to us wanting to have a conversation with the GP or have a conversation with the nurse about how it's affecting their health. And so we have a team of what we call our social prescribers within our organisation, who this winter are doing a particular project around cost of living and winter warmth. So we have 750 carers who are registered with our practice, and we are proactively calling all of those people each morning. So we ring up to 10 people each day to say, how can we help? And the idea of that is to both check in with the carer to make sure they're okay, and that's actually our starting point. It's not about the person who's being supported, it's about the carer themselves. And so we're doing a health check with that person to see how do we support, but then we're also talking about how is the cost of living impacting on you at the moment. Is it driving pressure around, can you afford the electricity to, for the equipment that you need? Basically, how can we help you with that? And that's throwing up lots of opportunity for us to support people in the community. And that looks like us literally helping people fill in forms. It looks like having hour-long consultations over a period of 12 weeks to support that person with a plan around how they can either get themselves back on the feet or support the care of the person that they're responsible for. It looks like linking them up with financial aid, mental health support, physical health. So we would still onward refer into a health appointment as well with an appropriate clinician. So we're trying to do a really holistic approach of talking to that person and finding out what's going on with them and trying to support them through this particularly difficult period. And that's been quite effective so far.